they say that in a crisis you need strong and decisive leadership and solid teamwork. You need to preserve cash, you need to be innovative, etc. The question is how to go about doing exactly that.
I think one thing very different from our delivery approach to maybe other webinar is we are very methodology focused, and we don't scratch the surface. We go down to what you're supposed to do, the implementation that you're supposed to carry out.
Hence, we deliberately design the session so that it is practical and hands-on to survive the crisis and to recover from the crisis.
I like the methodology. It was logical and there was good process to it. In fact, I have already set up a crisis management team for this. I found the session thought-provoking and a good call to action.
Data. Data is good. More data means better strategy. Better strategy means better results. Who doesn't want better results? But data can be boring. Data can make people yawn. Yawning shows disinterest. Disinterest leads to inaction. Inaction is bad. Creativity is good. Good creative gets attention. Attention leads to engagement. Engagement leads to, take my money! But creative can be polarizing. Some people like this, others like that. Disagreements lead to long emails. Long emails are not productive. Not being productive is bad. So what do we say? Screw choosing. We do data, we do creative. Data isn't boring because it's told through stories. Creative is less polarizing because it's anchored on data. Win! We like wins because we like results. Data is good. Creative is good. And we use both to get you real results.
Everyone has a story. Them, her, him, and even this cat. You see, whether they make you laugh, cry, or just leave you going, what the? Stories have a way of speaking to the heart. But what good is telling a story if it isn't heard? And that's where data comes in. Because when story meets data, you begin saying the right things to the right people at the right time. So whether your mission is industry domination, socioeconomic transformation, or simply to say, here I am, there's a story waiting to be told and a world waiting to hear it.
They say that in a crisis you need strong and decisive leadership and solid teamwork. You need to preserve cash, you need to be innovative, etc. The question is how to go about doing exactly that.
I think one thing very different from our delivery approach to maybe other webinar is we are very methodology focused and we don't scratch the surface, we go down to what you're supposed to do, the implementation that you're supposed to carry out.
Hence, we deliberately design the session so that it is practical and hands-on to survive the crisis and to recover from the crisis.
I like the methodology. It was logical and there was good process to it. In fact, I have already set up a crisis management team for this. I found the session thought-provoking and a good call to action.
Data. Data is good. More data means better strategy. Better strategy means better results. Who doesn't want better results? But data can be boring. Data can make people yawn. Yawning shows disinterest. Disinterest leads to inaction. Inaction is bad. Creativity is good. Good creative gets attention. Attention leads to engagement. Engagement leads to take my money. But creative can be polarizing. Some people like this, others like that. Disagreements lead to long emails. Long emails are not productive. Not being productive is bad. So what do we say? Screw choosing. We do data, we do creative. Data isn't boring because it's told through stories. Creative is less polarizing because it's anchored on data. Win! We like wins because we like results. Data is good. Creative is good. And we use both to get you real results.
Everyone has a story. Them, her, him, and even this cat. You see, whether they make you laugh, cry, or just leave you going, what the? Stories have a way of speaking to the heart. But what good is telling a story if it isn't heard? And that's where data comes in. Because when story meets data, you begin saying the right things to the right people at the right time. So whether your mission is industry domination, socioeconomic transformation, or simply to say, here I am, there's a story waiting to be told and a world waiting to hear it.
they say that in a crisis you need strong and decisive leadership and solid teamwork. You need to preserve cash, you need to be innovative, etc. The question is how to go about doing exactly that.
I think one thing very different from our delivery approach to maybe other webinar is we are very methodology focused, and we don't scratch the surface. We go down to what you're supposed to do, the implementation that you're supposed to carry out.
Hence, we deliberately design the session so that it is practical and hands-on to survive the crisis and to recover from the crisis.
I like the methodology. It was logical and there was good process to it. In fact, I have already set up a crisis management team for this. I found the session thought-provoking and a good call to action.
Data. Data is good. More data means better strategy. Better strategy means better results. Who doesn't want better results? But data can be boring. Data can make people yawn. Yawning shows disinterest. Disinterest leads to inaction. Inaction is bad. Creativity is good. Good creative gets attention. Attention leads to engagement. Engagement leads to take my money. But creative can be polarizing. Some people like this, others like that. Disagreements lead to long emails. Long emails are not productive. Not being productive is bad. So what do we say? Screw choosing. We do data, we do creative. Data isn't boring because it's told through stories. Creative is less polarizing because it's anchored on data. Win! We like wins because we like results. Data is good. Creative is good. And we use both to get you real results.
Everyone has a story. Them, her, him, and even this cat. You see, whether they make you laugh, cry, or just leave you going, "What the?" Stories have a way of speaking to the heart. But what good is telling a story if it isn't heard? And that's where data comes in. Because when story meets data, you begin saying the right things to the right people at the right time. So whether your mission is industry domination, socioeconomic transformation, or simply to say, here I am, there's a story waiting to be told and a world waiting to hear it.
They say that in a crisis you need strong and decisive leadership and solid teamwork. You need to preserve cash, you need to be innovative, etc. The question is how to go about doing exactly that.
I think one thing very different from our delivery approach to maybe other webinar is we are very methodology focused and we don't scratch the surface, we go down to what you're supposed to do, the implementation that you're supposed to carry out.
Hence, we deliberately design the session so that it is practical and hands-on to survive the crisis and to recover from the crisis.
I like the methodology. It was logical and there was good process to it. In fact, I have already set up a crisis management team for this. I found the session thought-provoking and a good call to action.
Hello and welcome everyone from across the globe to the launch of the Global COVID-19 Index, or GCI, the world's first holistic and comprehensive index on COVID-19. My name is Frida Liu and I'll be moderating today's session. Thank you for making time to join us today. Some housekeeping before we begin. The main proceedings of the launch will focus on our key speakers and panelists. Special guests and members of the media will only participate during the Q&A session at the end of the panel discussion. Questions can be raised throughout the event using the Q&A button at the bottom panel of your webinar window. You may also vote for questions to be prioritized for the Q&A session, and we'll choose the most popular questions to be asked first. To kick off our launch today, we have His Excellency Khairi Jamaluddin, Malaysia's Minister of Science, Technology and Innovation, who has been most supportive of Pemandu Associates' endeavour to develop this index utilizing technology and big data. Please welcome His Excellency Khairi Jamaluddin to deliver his keynote address on how innovation and open science has to take the charge in the fight against COVID-19.
Thank you very much, Frida. Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good evening, Idris, Woody. Ladies and gentlemen, welcome to the launch of the Global COVID-19 Index. As with all launches in the new normal, this is being done virtually from in front of a green screen here in Kuala Lumpur, Malaysia, and zoomed across the world. For the last few weeks and months, more than half of the global population has been in some form of lockdown. Many of us willingly sacrificed our fundamental freedom of movement in order to help break the chain of infection. We have had to learn how to practice physical distancing, wear masks, and pretty much wash our hands non-stop. And as countries continue to grapple with the pandemic, many of us are beginning to feel the cold winds of a potentially long economic depression that will come in the wake of the health crisis that we have yet to resolve. The International Labour Organization warns that nearly half of the global workforce is in danger of having their livelihoods destroyed. The International Monetary Fund has projected a global economic contraction that would be the steepest downturn since the Great Depression of the 1930s. Until a safe and effective vaccine is found, the world will have to live with COVID-19 and continue to balance lives and livelihoods by ensuring the spread of the virus is contained and economic recovery is accelerated. This will require an effective and globally coordinated response. While we have been focused on saving lives within our respective borders, we now need to reach out and share what each country has learned so that we can create an internationally crowdsourced playbook of best practices in handling the pandemic. While there are varying degrees of severity and recovery across the world, no one country has managed to get everything right. The unprecedented nature of the pandemic has resulted in different strategies in different parts of the world, and sometimes even within a country when they realize that the initial strategy was not working. And since we must accept that we have to live with COVID-19 for the time being, now more than ever, science, data, and technology must take center stage in guiding governments to make the right decisions for their countries. Many countries have already deployed science and technology in the fight against COVID-19. We have developed mobile applications to help with contact tracing. Face shields were quickly 3D printed when we faced PPE shortages. Robots are being deployed in hospitals to assist our frontline health workers. Today, the Ministry of Science, Technology and Innovation Malaysia, together with Pemandu Associates, brings robust data analytics into the global fight against COVID-19. We would like to humbly share the Global COVID-19 Index, GCI, with all of you. The GCI is the world's first holistic and comprehensive index on COVID-19. It rates and ranks 184 countries based on how well they are coping with the COVID-19 pandemic. The index comprehensively assesses the true severity and recovery progress of countries, taking into account relevant metrics such as the strength of their healthcare systems and socioeconomic factors. Its proprietary algorithm processes approximately 3,000 data points daily, pulling together metrics from well-recognized and validated open-source databases on governance and public healthcare. The GCI is poised to be a singular, holistic source of data that can facilitate informed decision-making for governments around the world in the fight against COVID-19. You may ask, but with many reliable indexes available, what makes the GCI unique? For us, it is the most comprehensive index on COVID-19. Apart from its own proprietary elements, it pulls together acknowledged data from other available indices globally. It is designed to assist countries in managing the COVID-19 pandemic. It can be instructive to governments, helping to make decisions on when or how they can lift restrictions, with which other countries they may want to explore creating a travel bubble. Its global ranking enables us to objectively identify the right countries to monitor and assess what measures appear to be working or not working in these countries. It can also be helpful to the private sector, serving as an indicator as to when regular operations might resume or when they should prepare a mitigation plan. Its basis on data, this is updated daily to reflect any changes in the global landscape. Now, what does the GCI measure? The GCI metrics are anchored on two key components, the severity index and the recovery index. The severity index measures how severe the situation is in a given country against its healthcare system's ability to contain and cope with the outbreak. The index normalizes key data points to reveal insights that may otherwise be hidden due to the high case numbers in larger, perhaps more prominent nations. The index is then rated on a severity scale to reflect the current strain on a country's healthcare systems. As such, it can serve as an early warning sign if the system starts to buckle under the number of active COVID-19 cases. Secondly, we have the recovery index, and this reflects the country's current progress in addressing the pandemic. It is also an indicator of how well a country is handling the crisis from a health and safety perspective. The index is then rated on a recovery scale to indicate where a country is on the road to recovery and its readiness to explore lifting its restrictions. For greater functionality to not only governments, businesses, but also to the public at large, we have made this information available on a dedicated GCI microsite for everyone around the world. This allows users to track a country's index movements, to determine its progress, or to assess in how the country is managing the crisis. We recognize the potential of the GCI in addressing and assisting countries around the world to formulate better strategies by offering a comprehensive and verified source of data on the pandemic. As such, the Ministry of Science, Technology and Innovation, Malaysia, supports the development of this project to make the GCI a publicly available resource for the benefit of the global community. We plan to follow up on the launch of the GCI today with an in-depth qualitative analysis of best practices around the world, which we are naming the Global Pathfinder Initiative. We will also be making that publicly available resource with the approval and agreement of participating governments. In support of open science, the GCI will be an open platform which will facilitate fast learning between various organizations and governments across the world. We're glad to announce that the World Health Organization, the Harvard T.H. Chan School of Public Health, the Susan Buffett Foundation, the Academy of Science Malaysia, the International Science Council, and Sunway University have all agreed to come on board to collaborate in this global initiative. Over the next 2 years, the Ministry of Science, Technology and Innovation Malaysia and Pemandu Associates will work together with these organizations to continue to improve the GCI and propagate its practical application in the global fight against COVID and also in tracking future pandemics. The partnership will aim to make the GCI a catalyst to enhance international cooperation and research against all pandemics. This is Malaysia's humble commitment to the fight against COVID-19. We hope that this will encourage similar partnerships between the public sector, governments, corporations, between countries to drive innovative solutions to help in the fight against COVID-19. I end with a broader observation and a humble appeal. Malaysia believes that scientific discovery that can benefit humanity in times of crises should remain open and available as a global public good. The GCI is Malaysia's contribution of data analytics and algorithmic application for everyone to benefit from in our collective fight against the COVID-19 pandemic. On a larger scale, this message of open science must carry through to what is perhaps the most important scientific research that is taking place around the world, the race for a vaccine. Apart from sharing the GCI with you tonight, the message that we would like to send is that we need to build a global alliance of international organizations, governments, corporations, civil society organizations, and individuals to commit to open science and push for the vaccine to be a global public good that will be made available openly and equitably. This pandemic has been one of humanity's greatest collective challenge in our lifetime, and it knows no borders or nationalities. It has attacked us all, and we can only defeat it if we act collectively to save all of humanity. Thank you very much.
Thank you, Your Excellency. I'm sure the audience is now full of anticipation on the global COVID-19 index. Please welcome Datuk Sri Idris Jala, President and CEO of Pemandu Associates, who will share with us the full story behind the development of the GCI. Datuk Sri.
Ladies and gentlemen, the COVID-19 pandemic is quickly imploding into a societal, economic, and business crisis, not just a health crisis. I think we all want it to go away. The question I want to address right now is, how long is this pandemic going to last? Experts around the world believe that this pandemic is not going to go away just like that. Then the minimum, the expectation is about 18 months, otherwise even 24 months, because as the minister has already indicated, it will take quite a while for us to find a vaccine or a treatment for this. So the only interventions that we have in the world to deal with this without the vaccine or a treatment is non-pharmaceutical interventions. And this is going to be a very painful process for us to deal with. And that is why we, in my team, have decided it is important that we develop an international collaboration with many parties. We are grateful for financial support and advocacy from the Malaysian government, from MOSTI, from Sunway University, and some other organizations that have also indicated they wanted to provide support. We have not got confirmation just yet. We also got reputable sources of data from Johns Hopkins University, University of Oxford, the World Bank, the United Nations Department of Economic and Social Affairs, the World Health Organization, the Global Health Security Index, an initiative that's made public and funded by the Bill and Melinda Gates Foundation, United States Census Bureau. And the GCI has been validated, and really we went through a very detailed improvement or pressure testing from various experts in the field. And I just give some example here. Some Professor Rifat Atun, who is the professor for global health systems at Harvard Chan School of Public Health, and Dr. Senait as well, from the chief advisor to the Director General for WHO. And we also have Professor Jeffrey Sachs, and we also have Dr. Samira, who is also the person in charge for data and analytics within the WHO. And we have many others from Malaysia as well, and the list is very, very long. And you can see it on the slide. And the reason why we wanted to do that is because we wanted a view that is taken in, the input into this model. It becomes such a rich model that we can then say it's a truly an international innovation. And I want to address the question about perception versus facts. Ladies and gentlemen, you know, you receive email from us asking you some question in a very simple survey. One of the questions we raised was, do you think that the global COVID-19 curve is flattening? The response from all of you is 57% of you, most of you believe that the active curve is already flattening. Only 43% believe it is not. Actually, the data shows the opposite. In reality, the data trend shows that the global active cases are still on the rise on a daily basis. From a global standpoint, we are still not winning this fight against COVID-19. We also asked you another question. What are the top countries in terms of recovery? And your answers are, the top 2 countries in terms of recovery are China and South Korea. Actually, the data, ladies and gentlemen, is the top 2 countries in terms of recovery are Australia and Thailand. This is why I say, sometimes what we are saying in terms of the perception is not backed by reality and the facts. And I want to just build on a little bit of what the minister had said before, what the GCI compromises. And I just want to say that in terms of severity index, we measure the facts on the basis of the number of confirmed cases per population, the proportionate death rate due to COVID-19, and these form 70% of the weightage that's granted for severity index. And we also take into account the global health security index that is done together by the Johns Hopkins University, funded by the Bill and Melinda Gates Foundation in the GHS category 6 and 5. On the recovery side, 70% of the weightage is given for number of recoveries per confirmed cases, number of active cases per population. We also recognize that the more you test countries, the more you discover confirmed cases. So we give credit to countries that conduct a lot of tests. That means the number of tests per confirmed cases, the number of tests per population. We also took into account the measures that are taken by each country and rated by the GHS index to see whether the countries are doing early detection, on the responses are very good, on how they're dealing with it in terms of dealing with the sick, and also to protect workers. And so after we've done all that very massive algorithm that is put inside there, we are able now to rank 184 countries on a daily basis based on the data. So for the last time that we began to develop this, the number 1 country in terms of recovery is Australia, followed by Thailand, followed by Korea, South Korea, Taiwan, Republic of China, New Zealand, Denmark, and then etc. You can see the list. Really, when you think about these countries, I think what you have in mind about the countries that are doing well are not necessarily these countries in the top 20. My own country is number 12. We're quite happy with where we are today. I mean, last week we were number 8 or number 9. Well, recent past, the numbers is escalated, so we dropped to number 12. You can see that the ranking really takes into account the facts of the case. Ladies and gentlemen, I'm really very pleased to say that we now have reached a point that we can now put out to the public the full ranking of every country in the world, 184 countries with all the data that's available. Thank you very much.
Thank you, Dato Sri. With that, we'll now unveil the Global COVID-19 Index for the very first time to the global audience. I had a sneak peek a few days ago. Please welcome Woody Ang, Executive Vice President of Pemandu Associates and creator of the GCI engine. Take us through an exploration of the Global COVID-19 Index. Over to you, Woody.
Thank you, Frida. So as His Excellency Khairi mentioned just now, the whole intention for us to develop this was to make it as available to the public as possible. So ladies and gentlemen, I'm proud to introduce you to the GCI microsite. You can actually access it right now by going to the URL covid19.pemandu.org. Now, what you will be seeing when you are greeted on this website at this moment in time would be the recovery rating of the world as an entire entity, and also the severity rating. And you have, at a quick glance, the world map. That world map has got multiple colors there. We have a guide down there which shows you the numbers. 5, which is a light blue, tells you countries around the world that are coping better and recovered better from the pandemic at this moment in time. And you can see a lot of the countries in Oceania, some in Asia, and some in Europe as well. The toggle down here would switch it over to a heat map on the severity index. So that's something that's dynamically created. You can actually hover on any country to see what their scores are. The guides are down there. And if you scroll further down, what you'll be greeted with is yet another world map. And in this case, it's tracking the stringency levels that have been implemented by governments as of current date. So as every day changes, we actually update this information as well. The darker color it is, the more strict the lockdowns are. When you toggle the map to the next one, this is the one where we actually used information from our index, analyzed on a daily basis, combined it with the Oxford stringency and the government tracker as well, combine it with various other indexes that come from the GHS, and we are able to then define countries that have an indicative chance to look at the relaxation of some of the restrictions. And if you look at it from a quick glance, it will not surprise you as well, as countries in Oceania, Australia, New Zealand, China, you've got Japan, Korea, Thailand, and the like. And even our country in Malaysia can already start considering the relaxation of the restrictions. So this is also updated on a daily basis on the 6 criteria that the World Health Organization actually lists down. And we actually update it the moment the details come in on a daily basis. Datuk Sri Idris earlier showed you this visual. And you can also see, if you ever want to find out how the world's infection trend is moving, the yellow columns are the new cases in total on a daily basis. And the blue line is the active cases currently. So that will effectively tell you what is happening in the world today. We've also built a comparison matrix, and the whole intention about us designing an index like this is to find best practices and to compare countries of similar characteristics or the like. Now, country comparison matrix allows you to do this. You use on the y-axis, the higher up you go, that's the severity index. From left to right, that's the recovery index. Now, countries that have been hit badly are going to appear on the top left or top right. But the further they move to the right is when they're recovering. So we have actually listed the top 5 in every continent and also the bottom 2. So in this case, you can see Iceland, you can see Denmark, you can see Switzerland, and you can see the countries in Asia like Malaysia, Vietnam, and whatnot. Effectively, what you're supposed to be able to tell from this is countries that have been badly hit move closer to the right. These are the ones that have recovered from a high severity that they've faced. Whereas countries that are appearing at the bottom may not have been hit so badly, may have taken action very quickly, and however, have been able to recover as well. So that's how you use this particular matrix. And naturally, you will find the full list of 184 countries here. By default, it's the top 20, but you can, at any point in time, extend it to all, and the full list is available here. You can also run a search for the country of which you are residing, of interest to you, or even sort by a continent, and you can sort for all of Asia, for example. Now, if I bring your attention way back up to the side, we are tracking the country movements on a daily basis. So the top 3 changes in a recovery index and the severity index are tracked. But what we've also built is an ability for you to select any country amongst the 184 for you to then see the details of each country itself. So I'm going to pick my home country because it's close to my heart. Now, as it currently stands, we are ranked 12th. This is the trend of our recovery rating, our recovery index. And when you look at the infection trend, we always hear about the flattening of the curve. And I'm going to show you later what that actually means. Now, if you follow the confirmed cases only, that line never comes down. So it's almost impossible to see a flattening of the curve there. But it's when you look at the active case line that you start seeing whether it's flattening or not. We also track the new cases that are coming in on a daily basis, recoveries, the deaths. And we can select any country around the world to do this. But another unique tool that we've built was actually given to us when we got a lot of feedback, constructive feedback from different people that we spoke to. Now, it's very important that countries are able to find out which countries around the world are most similar to them in terms of population, in terms of density, in terms of their climate, their income levels. And what we've built in here is a predefined tool that looks at what country you've selected and finds the countries that are the closest match to you. So it may surprise you that when you think of Malaysia, sometimes you think of our neighbors down south in Singapore. But Singapore is a very dense, small city-state. But when you look at us from a density perspective, population, income levels, the countries that are most closest to us are actually in South America, the likes of Colombia, Cuba, Venezuela. And this will update itself for any country around the world that you pick. So if I were to go and pick Singapore right now, Singapore has got a very good example of the flattening of the curve. Now, as you can see, the active case line has actually flattened and is now coming down. So they are on the path to recovery already. So we built all of these tools here. And in the spirit of open data, you can actually go on the left here to click on Analytics. On a daily basis, the dynamic parameters that we use are available here. So from the severity index perspective, we actually make public the data set that says when the first case date was recorded, the confirmed case per 1 million population, the proportionate death rate due to COVID. So you can easily sort this if you're interested as well to see which one's the worst hit and whatnot. The COVID-19 fatality rate, also possible to sort. That's from the severity standpoint. If you scroll down, we have all the data, dynamic data, that we also use from a recovery index perspective. Now, I know that was a bit brief. In the event that you get lost in this website, we have a full about page which describes how it works and all the instructions to use the tools that have been made available to you. Now, this is just the tip of the iceberg, ladies and gentlemen. The microsite demonstration was just us trying to put as much as we could in a short time frame, what we've already built behind the scenes for the GCI. And on this regard, I'm now going to walk you through the other features that are already available online, but have yet to be put on the website, and we are planning to do this progressively in the days and weeks ahead. Now let me walk you through these features that are already there. The first is three-dimensional visualization. The earlier one you saw on the website was a 2x2. We've actually built one that has got the active cases per 1 million population visualized as the size of a bubble. This becomes more intuitive because when you see the bubble shrinking, you know things are improving. And the further to the right it moves, the better it is. But when you're looking at research and whether progress is being made, you're also interested to see over a series of time what's happening. And we also have that in our offline model. In this case, we've taken the 8th of May all the way to the 2nd of June. You can select any of the 184 countries, and you can see which direction these countries are moving. So for example, Chile, Brazil, these are countries that are worsening. Iran is actually going through another round of worsening as well. Denmark, Czech Republic, Malaysia, New Zealand, these are all improving over time. United States, very small movements in recovery, not as significant as everyone's expecting for now. And that's a tool that already is available. You can select any date range and select any country, and you can see that. The next feature set, we have also started looking at the effectiveness of the containment measures. Because we've got the good information coming from the Oxford Coronavirus Tracker, we're able to tell when the lockdowns occurred. And what we actually did was we took the date that occurred, waited 14 days for the actions to take place, and started to see across 30 days how effective these measures were in reducing the number of new confirmed cases over that period of 30 days. And that, again, allows us to see which countries were effective in their implementation, again, to look for best practices, and which ones were maybe not so effective. And it could be implementation issues. It's not for the lack of intent, but every country has different parameters. But this is yet another tool that we have already built that allows us to isolate instances like this. We've also got a full correlation engine, and we've got a lot of rich data in this correlation engine. We've got gender, we've got age statistics, because we're interested to see if the more population with more senior citizens are more susceptible. We've got climate information, we've got foreign labor population, we've got GNI per capita density, first case dates, stringency measures, and we're working with our partners, particularly the Academy of Sciences and Sunway University, to identify yet even more rich data that can go into this model for correlation analysis. And one of the most interesting things that we discovered just in the past few days is when we did a correlation between foreign labor population in a country versus confirmed case. And we found a near 100% correlation to that. So, and that sort of analysis is now possible. So we can actually change the dynamics of this and see what it yields to us. And this is of significant interest to the academic world at this moment in time. The forecast engine is something we also have. Now, all of you out there have probably heard in your readings in the news of the SIR model, the SEIR model, the R0, the reproductivity index. We've consulted epidemiologists, we've consulted health professionals, and they all say that in order to do the SIR and SEIR, you actually need to know very nuanced assumptions about each country. Now that's information that is not available to us, and so we didn't want to take the risk of that. So what we instead did was we used evidence on the active case line decreasing, and we used a probability forecasting method that's known as the Monte Carlo method, commonly used in finance and unpredictable events, but we tied it to a single parameter. And on the basis of this, we took Singapore as an example. On a 50% confidence at this moment in time, we think that it's in early July that you start to see 90 to 95% case reduction. And we can do this for all 184 countries. Now, of course, for countries that are seeing an incline, an increase in their active cases, we do not forecast that because we'd actually be predicting something that's not quite possible to do. Unpredictability there would mean that we will not forecast such situations. At any point in time, we have live custom reports that are reported daily, updated, that's based on best and worst performance in terms of region, income, density, first case dates, and therefore we're also able to draw correlations there. Ultimately though, the GCI is only an enabling tool. What we aim for this to be is an enabler to the Pathfinder initiatives that His Excellency Khairi mentioned just now. It is very important that we use this tool to find which countries to look at, to engage, to take the lessons learned, and find that lessons learned and share it with the world. That's part of the whole initiative. So the GCI on its own is not the tool that you are supposed to envision. It's together with the Pathfinder initiative that we're working on with the UK's Delivery Associates, led by Sir Michael Barber, that we are intending to do this over the next 2 years. And it's just going to get richer as we go. We have the plans to put all of that you saw just now online as soon as we can. And that's our contribution from Malaysia in the spirit of open data and open science. Thank you very much.
Thank you, Woody. That was enlightening to say the least. Now, we have a lot to discuss based on what we've seen here. But before we begin our panel session, which I'm sure you've all been waiting for, we will now take a short break. We will be back in 2 minutes, so stay tuned. Welcome back to the launch of the Global COVID-19 Index. We have now seen what the GCI is and what it can do. There's a lot for us to ponder here. What really is the best way forward? What is the game changer? How can big data and technology play a role in combating COVID-19? And to help us delve into this further, please welcome our esteemed lineup of panelists. Firstly, we have Tan Sri Dr. Jamila Mahmud, who currently serves as a special advisor to the Prime Minister of Malaysia on Public Health, a humanitarian and doctor by training. Dr. Jamila is well known as the founder of Mercy Malaysia, a volunteer relief organization that provides medical and humanitarian services locally as well as abroad. Next, we have Professor Rifat Atun, who is a professor of global health systems at the Harvard T.H. Chan School of Public Health and the faculty chair for the Harvard Ministerial Leadership Program. We also have with us Dr. Sinaid Fiseha, who is the chief advisor to the World Health Organization's Director General, Dr. Tedros Adhanom. Also from Malaysia, Professor Awang Bugiba Awang Mahmud, who is a professor of epidemiology at the University of Malaya. He's also the Secretary General for the Academy of Sciences Malaysia, Malaysia's foremost science, technology and innovation think tank. And next we have Professor Jeffrey Sachs, who is a professor and director of the Center for Sustainable Development at Columbia University. We heard earlier from Budi Ang, who will also be joining us on the panel. And last but not least, Dr. Sri Idris Jala, the president and CEO of Pemandu Associates, founder of the Big Fast Results methodology, 8 Steps of Transformation. And Dr. Sri Idris has dedicated his career to helping business and governments globally through rigorous transformational and innovational strategies. For his contributions, he was recognized by Bloomberg as one of the top 50 most influential policymakers in the world in 2014. Before we begin, a reminder that questions can be asked during the sessions through the Q&A button. You can also vote for questions to be prioritized. And thank you, His Excellency has also stayed on here. The first question is Dr. Sinaid Fiseha and Professor Jeffrey Sachs are unable to join us for the event, but we have
COVID-19 pandemic. I think being able to prepare countries to open up their economies, to re-strengthen their health system. It's a great piece of work that needs to happen. Of course, WHO has put together a 6-step guideline on how countries can prepare to open themselves up. But that alone is not going to do it, right? We have to look at and say, what happens when countries open up? What has happened with the countries that have tried to open up and that are getting set back? So being able to do this continual global surveillance of data and looping back to continually analyze and advise countries, and doing so not only based on countries' own experience, but also the experience of others, is I think the critical piece GCI is going to bring to this space where there are a plethora of institutions that are gathering data, and I think they are doing a fantastic job getting us minute-to-minute accurate information. But I think this is where an index like GCI can play its part by providing steady and accurate stream of data on how well countries are doing, not just on reporting the infection, but also how well they are doing responding to the crisis. It's going to be an incredibly useful resource to complement the work in identifying real global best practices and how they can be applied to different countries. And with severity of monitoring, we can also ensure the necessary intervention and help will get to those who need it the most in a timely manner. So I'm extremely excited to see you in this space, because you not only will be now addressing the public health aspect, but also the massive economic aspect that needs to be dealt with. So very grateful for the work you're doing.
Thank you, Dr. Sinaid. Next, Professor Dr. Awang Bugiba. The field of epidemiology heavily depends on data, but much is still unknown about the virus itself. Can you share some of the key challenges that epidemiologists face in strategizing to mitigate this COVID-19 virus? Can you share some examples in Malaysia or other countries?
Thank you very much for inviting me. As epidemiologists, we deal with a lot of data. And there's always the need for very good, solid data, which is reliable whenever we develop models, for example. And a lot of talk has gone into things like SIR models, SER models, and the computation of, say, the R number, whether it's RT or R naught and whatnot. But the problem with a lot of these models and the data is that one, it takes time to compute. And number two, it relies on data which may not be completely reliable. So, with this COVID-19 pandemic, the speed of spread of the COVID-19 pandemic means that we cannot really wait for models to be developed based on the usual traditional approach, which is why I'm glad to see that some of the indicators which have been put inside this particular index are indicators where there's very little dispute, and that the numbers can be relied on, and in ways which perhaps the traditional models could not really do. So, for example, if we were to take a test, for example, the number of confirmed cases, that would really largely depend on the number of tests that you do. And it is dependent on the size of the country. So the population density of the country has to be computed together with the incidence density of the cases. So in other words, it's a bit more complicated than just counting the number of cases and so on, which is why I'm glad to see that this is an accurate reflection, for example, of the severity of the epidemic, and something which can be computed quite easily on a daily basis.
Thank you, Professor. We move on to another professor, Professor Rifat. In the midst of all this, there are many debates about which strategies work best in managing the pandemic when a vaccine may still be a while away. Some have argued that we cannot sustain lockdowns until then and are willing to take the risk in order to keep the economy alive. Others have advocated for herd immunity. So how can we truly assess what is the right thing to do?
Yes, first of all, congratulations to Pemanda Associates, to the Ministry of Science, Technology and Innovation and Sunway University and collaborating groups for this really incredible initiative. I think it will provide much needed intelligence to governments and large organizations in identifying best strategies moving forward. That said, your question is a very important one. And there isn't the right answer, unfortunately. As we have seen, different countries have followed different strategies. And again, each country has had to balance public health with economy and the social impact of the COVID-19 pandemic. But what we've seen clearly is that countries that moved early and introduced restrictions in terms of hygiene measures, in terms of social distancing, in terms of reducing mixing, and many went as far as lockdowns, were quite successful. And we can see many countries in Southeast Asia, New Zealand, Australia, Thailand, Malaysia, Taiwan, as well as China have been very, very successful. We also see in European contexts, Austria, Iceland, and small countries such as Slovenia that have also been successful. But we also see countries that have pursued very different strategies without the lockdowns, with the use of, in the case of South Korea, technology to identify very early infected cases, use technology for contact tracing, and then quarantining the contact cases and isolating the infected cases. And South Korea, interestingly, did not have to lock down. They managed to keep the economy functioning with social distancing and use of face masks, but very aggressive testing, contact tracing, isolation and quarantine strategies. We see a similar strategy in Japan. Again, without lockdown, these countries have done fairly well. And we also see in the European context a country like Sweden that has pursued a very different strategy to others. Again, with use of social distancing and other public health measures to try and mitigate the effect of the pandemic in Sweden. And again, I think the jury is out in the case of Sweden, because what we are seeing is that the herd immunity there has not developed. And herd immunity in the case of SARS coronavirus 2 given the basic reproduction number, we need to have about 60% of the population infected. And some countries that tried the herd immunity approach, such as the UK, had to very quickly reverse their strategy and introduce restrictions. So there isn't a single approach, but we're seeing different approaches adopted by different countries in the first phase of the epidemic. We are now entering the second phase in many countries.
Right. So rightly so, Professor, you said that countries around the world have taken vastly different approaches to managing the pandemic, some even unconventional. So what are the most outstanding practices that you have observed so far, and what are the key issues with countries who are really struggling with the virus?
Clearly, what has worked is early response in introducing public health measures. And we've seen many countries in Southeast Asia who have done this. New Zealand has been successful. Australia have been very successful in achieving that. Secondly, countries that have used technology with aggressive testing, contact tracing, isolation, quarantine, and focusing on clusters with real-time monitoring of what's going on. I think a third interesting approach has been, in addition to the general public health measures, use of face masks. And I think this is something we need to explore more in the context of Asian countries, which I'm sure is a very, very important contributor to containing the pandemic. But clearly what has not worked is where there's been confused messaging by leaders, inconsistent policies, policies that have not been introduced long enough to have an effect. Again, in some countries we are seeing the federal level or the central level acting in one way, but the provinces or the states acting in another. And we are seeing that the epidemic is not under control because one is dealing with a chain, and the chain is as strong as the weakest link. The response needs to be holistic, and it needs to be consistent, and it needs to be comprehensive. Otherwise, the viruses don't recognize borders. They'll just cross from one setting to another setting, and the transmission will just propagate.
Holistic, consistent, and comprehensive. Dr. Jamila, Malaysia has largely escaped global attention, but the country has done fairly well in managing the pandemic thus far. In fact, we recently ranked 4th in a global survey on public approval of the government's response. So can you tell us a little about our country's approach in managing COVID-19 and why this has been effective?
Thank you very much, Frida. First of all, congratulations to Pemandu and Mosti for this incredible, gift to the global community. I'm very much encouraged that it was a very robust process, and all your team listened carefully to everyone who had given your input. So really, congratulations. The first thing I will say about Malaysia's experience is that experience itself is a great teacher, and Malaysia has gone through several epidemics, and you will remember the SARS pandemic, and also we had Nipah virus, H1N1, and therefore, our public health system and our health ministry has been able to develop a really robust playbook. And very early on, since the onset of COVID in this country, this was implemented completely through previous experience, using methods to contain, having dedicated COVID hospitals, which is really essential in the early days. Everything that has been done is really guided by evidence-based decision-making, and therefore this is where data and facts becomes quite critical. And when you see the data and the numbers, of course, all this has to then point to how we approach the management, which is really about testing, containing, treating, tracing, and these are, all done seamlessly because it's needed. And again, congratulations to Mosti for developing, MyTrace. We also have MySejahtera, Grow Up Malaysia, a few apps that can help the public to be able to capture what is actually going on, and also look at contact tracing. Also, we've had portals such as outbreak.my, and now with GCI, this is all going to help us. Now, The other factor that we cannot underestimate is actually public trust. And Malaysia has consistently presented data and numbers to the public on a daily basis through its Director General of Health, who has been able to take on questions from the public, from the media, from journalists, and really presenting all this data in a transparent way. And I think this is very important, because you can tell people to practice the social distancing, hand washing, covering their faces, wearing a mask, but they won't do it unless they actually trust that this is really a reason why you do this. And I think very importantly, the Ministry of Health presented the R0 and RT that was mentioned before, using the SRR modeling to show the public that before the movement restriction order, the R0 was 3.55, and right now, after the movement restriction order, and now with the more conditional movement restrictions, it is down to 0.3. So I think this is really heartening to know that there has been impact on the restriction of movement, which was again a very important measure undertaken by the government to restrict movement of the population. The other thing, of course, is being able to really identify what are the risk factors. And one of the biggest risk factors for Malaysia is actually protecting our borders, making sure that those entering the country go into quarantine, are tested, also testing foreign workers, migrants, because these are people who are, living in conditions that may cause them to have a higher risk. And I think this is an investment that has been made by the government that has shown some results. I think one of the things I would say is that for healthcare providers and for governments, for decision makers, data is critical. So one of the best things about GCI, I think, is that one of the things we've learned from COVID is that we need to be humble. What we're learning every day is something quite new. All the strategies that have been employed, we make assumptions, and sometimes our assumptions are not right, and we need to quickly revert what we're doing. Humility is key in managing a pandemic such as COVID and this coronavirus. And I think that what GCI does is presents to us on a daily basis data which is so comprehensive and robust. We are able to then tailor what we do, how we react, and most importantly, how do you build a network to learn from each other. I would say that we should have anticipated this. We all saw this coming. This is not a black swan event. We knew that a pandemic was happening. It was a question of when and not if. And I think that with GCI, it will actually help us propel into the future and really do much more foresight and much more analysis that will guide us into what we do better next time. And I want to end with one thing. Data and numbers are exciting. They are really helping us as scientists, as leaders, to try to make the best use of that data and analysis. But behind every number is a mother, a father, a child, and I think we always have to remember at the end of the day, everything we're doing is really to make sure that people who are exposed to the virus or at risk, and they are protected, and that they are also be able to receive treatment, to receive testing, and so that all of us, not just in Malaysia, the entire world, will soon see the end of this. I think we have to have a narrative that is inspirational, encouraging, and if you have the numbers, you'll get that narrative. Thank you very much.
Thank you, Dr. Jamila. Okay, the next question is for you, Woody. Attempting to encapsulate the entire country's public health situation into one index seems to be an ambitious undertaking. Is there a risk that the GCI oversimplifies the picture and may lead to the wrong conclusions or comparisons due to its varying components?
Thank you, Frida. I think it's important to remember that when we design this GCI, it's meant to help point us into a direction to look. But ultimately, it's what we look and what we find that becomes powerful for all of us to learn from. So essentially what we've done is given as many different perspectives, different lenses to look into how do you find the next best practice and what is most relevant to me, be it from a country that has been worst hit and now recovering, or something of a country that has similar characteristics as well. And once you put all that together and you slice it in different ways, you start to see I think I should look at this country and then reach out in a diplomatic way and say, how did you do it? Because that, I think from all the information we have, it seems that it's working. But it's these best practices that once we learn and we share it back to the world, it enriches the entire experience here. So this is really only the start of it. A lot of people ask about the fact that once you start this, you know, what next? The amount of analysis, richness in research that we can now do, and I think that's where the Academy of Sciences is very excited to start engaging with the international community to see how we can use this. Sunway universities are restarting to see whether we can look at hospitalization data, you know, whether it's multiple disease and whether there's a relation between all of this, because that's also what they want to give back to the scientific and health community as well. So all in all, the GCI is not meant to be a be-all and end-all. It's really a tool and an enabler for us to point our eyes in the direction that maybe in following the media that likes to follow where the big numbers are, where we're not really looking. And so that we actually, all of us, start looking at places, and together we might actually come out of this even faster than we would otherwise just trying to follow where the news is taking us.
Okay, and here's a question from Dato' Sri here. How can the GCI support effective public sector delivery?
The first thing that it does is that the GCI provide data analytics to all leaders in the world so that they know how to manage this pandemic. I think what we find today, most leaders in the world, they are bogged down firefighting. There are not enough resources and time to reflect on the lessons learned from other countries. So as we have all said, there's a global Pathfinder initiative that will follow this hand in hand, that we're working with Sir Michael Barber to approach countries so that we can codify the best practices and we can share it with all countries, including what doesn't work as well. And so that's important. And the second part is how the public sector can really help in delivery is the question of the trade-off between the health agenda versus the economic and business agenda. You can't lock a country permanently and then there's no more jobs. People will really out of jobs and the country will collapse economically. So the data will tell countries when they can begin to open. You can even, as the minister had already indicated, you can even decide amongst the countries that have made huge step forward in recovery, they can have a travel bubble. They can open the corridor among themselves. People can then fly among each other. But more importantly, leaders must learn from one another. Today, if we don't get the leadership in all the countries in the world to be able to do this, it's a problem. What we didn't tell you today is that the system, the GCI, can also do analysis by district and by states. We have already developed it for the whole United States, all the 50 states in USA. We now can say which of the states in USA they can relax today. Hawaii, they can relax today. Alaska, they can relax today. Which are the states that they really, President Donald Trump has to focus on. It's clearly the top states include even Georgia, they're relaxing it. So you have to make sure that data is made available so that the presidents in countries, the prime ministers in countries can focus their attention on the states and the areas that really need help and to deal with this.
Right. What about with the private sector?
Oh yeah, this is a big problem, Frida. You know, I had run quite a number of webinars with small enterprises and medium. Many of them have cash lasting no more than 3 months. Those businesses are going to collapse if the prolonged lockdown takes place. So I think in the private sector, they will look at the GCI as a tool to help them develop business scenarios. How long is this going to take? The prediction is that it's going to go on for 18 months or 24 months. What will happen during that time will be intermittent lockdown or intermittent MCO. So then businesses has to figure out what they do during the lockdown, what they do when it's beginning to open up. And I think the situation is forcing the private sector to really look at innovation, how they can make a huge change in the way that they are dealing with the business. How do you sell via e-commerce and how do you deliver to homes rather than, and people working from home. Today, the name of the game is working from home. The technology is available today. I think if this pandemic was to take place a few years ago, when we didn't have all these video conferencing facilities, it would be very difficult to do it. So today, the tools and technology is available for us to do that, but the private sector has to innovate.
Okay. Now, before we end the panel session, let's hear what Professor Jeffrey Sachs has to say. The professor, one would typically assume that developed countries with more resources would fare better in suppressing the outbreak, whereas poor countries would be worse off. Now, is this really the case?
I've been pointing out in the United States for months that the Asia Pacific has done a better job. It's not the simple story that the rich countries do better than the poor countries, not at all. Some of the richest countries, including my own, have done the worst because they have not paid attention to best practice. They have not followed the evidence, and therefore, and they have not learned from the success stories. So what you're doing is extremely important. What made the Asia Pacific region do better is that the control measures were much more targeted. People didn't trust China. So from the first moment they started policing the borders, they started watching the cases, they started tracking the cases, people wore face masks, they were afraid of getting infected, they didn't believe anything, so they were very cautious. And most of the governments did a good job in the region of control. And in fact, even countries, you know, Vietnam, Myanmar, Laos, Cambodia, all did an excellent job with very little resources by being very vigilant. Whereas in Europe and the United States, it's kind of ignorance and arrogance of just letting the virus spread without even knowing that you have an epidemic. Believe me, we're stupid in the United States. And so it was public stupidity, starting with our president, but actually throughout the society that caused the thing to get out of control. You know, what I think is really necessary is to measure the real quality of the health, not the hospitals, but of the surveillance system. It's surveillance that is the real key here, so that any infection is stopped, it's trapped, it's quarantined. This is really the point that we need to help countries to understand. If you want to control this, you need a system, a system. It has to be rigorous. You have to be serious. You have to get data every day. You have to know what's going on. All we do is argue, should we have a shutdown or not? But that's not the point. The point is the systems. So you're on exactly the right track. It's really important. And what we have to teach the world is about systems thinking, you know, to be methodical in this. Because if you don't have a serious government, it's impossible to control. And we don't have a serious government in the United States, Mexico, Brazil. These are populist leaders who, you know, are just making it up every day. And this is what's going wrong.
Thank you very much. You know, Your Excellency, you've heard all the panelists share their views and thoughts. You know, we'd like to hear what you have to say after hearing all of them.
Firstly, one of the reasons why the Ministry of Science, Technology and Innovation is working together with Pemandu Associates on the GCI is because from the first day, Malaysia has relied on data and science to combat COVID-19. All our decisions, whether it's the movement control order, advice, public health advice that we've been giving our public is based on evidence-based research and science. And because of that, when Idris came to me with this idea and showed the initial model, I said, this is something that we really need to share with the world. I mean, we haven't gotten everything right. No country has gotten it right. Every country has made mistakes. We've had some shortcomings. But it's only through sharing data and it's only through sharing our experiences that we can learn to confront COVID and future pandemics in a better way. I've written to my counterparts and the health ministers of some of the countries that we've identified to ask them and to appeal to them to share their best practices, what they've done, especially countries who rank quite high in the recovery index. And that will be the crux of the Pathfinder Index. That will be the foundation of the Pathfinder Index, which we'll work on in the next 2 years so that we can be more prepared in the future. Look, Dr. Jamila is right. this wasn't a black swan. It wasn't if, but it was when it was going to happen. And science tells us that there are tens of thousands, if not hundreds of thousands of zoonotic diseases which haven't jumped from animals to humans yet and could happen. And of course, the great influenza pandemic that many scientists are predicting that will happen. So the GCI is a model for us to be prepared for these pandemics in the future. Finally, I think all of us here believe in an open science platform, and I would really like to repeat my appeal that this open science that we are celebrating tonight is not just about data analytics, but extends into every facet of scientific research that has to do with COVID-19, especially when it comes to the vaccine.
Thank you. Before we move on to the Q&A session, let me first thank our panelists for their excellent sharing on this topic. We'll now take some questions from participants and journalists for the panelists to answer. So let's look at our first question. All right, this is from Sharizal Sharani. What is Malaysia doing to ready itself to receive a vaccine formula and manufacture in Malaysia cost effectively? How can we make it accessible to all, especially the new vulnerables, out of jobs or no income post-pandemic, and who will not be able to afford it? Tan Sri Jamila, would you be able to take this question? Okay, I think, are you on mute?
No, I'm not on mute. Maybe you muted me.
You're back.
Malaysia has been very actively engaged with WHO, and the Prime Minister has himself, had conversations with very, very senior leaders around the world about this. I think very importantly, there's a very strong call that this has to be a people's vaccine, right? It has to be something that is available to all, and equity in, the access to vaccines is going to be very important. So that's one. The second thing is that we have also engaged ourselves to be one of the countries that will undergo some of the trials, so that will be good. And I think very importantly, and I'm glad the minister is here as well, I'm sure he agrees that most importantly is how do we get, the rights to produce the vaccine in the region, locally in Malaysia, and as well as in ASEAN, as a bloc in ASEAN with a very large population, how can, we ensure that even if it's not one individual country, perhaps as a regional grouping itself, that we have to have a stronger negotiating power in terms of receiving the vaccines. The good thing about Malaysia is that our public healthcare system is accessible to all, and vaccinations are part of routine immunization, even, if there are people who fall off, like they can't afford healthcare, public healthcare is available to them. So, let's hope that when there is a vaccine, and we hope it's sooner rather than later, that number one, we will not have a vaccine that's going to be controlled only by developed countries, that countries like Malaysia, countries in this region will have access to not just a vaccine, but also production to drive the costs down. And three, that we'll have equity in ensuring that every Malaysian has a right to that vaccination.
Can I just add on to that?
Sure.
There is a cabinet task force which involves the Ministry of Health, the Foreign Ministry, as well as the Ministry of Science, Technology and Innovation that's looking into the vaccine issue in Malaysia. And I'd just like to add on to what Dr. Jamila said. Apart from obviously working together with the World Health Organization, we've reached out through the Ministry of Foreign Affairs to countries which are leading the race in developing the vaccines to see whether or not we can access the vaccines once they are commercialized. But we also want to make sure that we are not, every country, I suppose, wants to make sure that there's vaccine security. So we have looked around within Malaysia for manufacturing capability. We don't have the full spectrum of human vaccine manufacturing capability in Malaysia, but we do have capability for fill finish, which is essentially where you bottle the vaccine into vials. So we've been discussing with a private, it's a government-linked company to see whether or not we could nationalize that particular facility so that we can bottle the vaccines. We're also even looking at buying manufacturing capacity in other countries. But of course, this is something that we'll have to continue to monitor, because there are different types of vaccines that are being developed. There are RNA vaccines, inert vaccines, live attenuated vaccines. So what kind of manufacturing facility we end up securing will depend on which vaccines cross the line first. But I think science diplomacy is very important. I'm working together with the Minister of Health, Minister of Foreign Affairs, to ensure that we have good relations with the leading countries, with the United States, United Kingdom, with China, so that Malaysia will be a recipient. But this is a short last point. I think this is something that we'll have to also discuss in terms of public health, is who gets the vaccine first in the respective countries. So I think, you know, there will have to be a protocol that the Ministry of Health and the government has to develop as to who gets it first. Frontline workers, vulnerable groups. So I think we have to be as equitable and transparent as possible when it comes to administering the vaccine to our population.
Right, thank you. We'll look at our next question. This is from Jehanwan Aziz. How does this index compare to other similar initiatives already mainstream, such as the COVID-19 dashboard by the Center for Systems Science and Engineering at Johns Hopkins University? I think, Prof. Rifat, would you be able to take on this question?
Yes, of course. I mean, that was very clear in the presentations by His Excellency the Minister, Woody, as well as Idris. In identifying the unique properties of the index. What Johns Hopkins data system does is actually produce for each state number of cases, number of deaths by country. But actually, what COVID, what the new dashboard is actually trying to do is to identify what we are. Not just what we're observing, but actually why we're observing what we're observing, i.e. which countries are doing well and why. And trying to make some sense of clusters of countries that are demonstrating good practice in relation to stringency, but also in relation to, very importantly, recovery. And that is critically important because we're now entering the new phase. All the effort was to contain the virus, but now we have to think about opening up countries, but in a very controlled way. So the evidence from the recovery index will be very important. And what the index does is to provide some evidence to us to say which countries are doing well. And as more data will become available, we'll be able to ascertain the trajectory of performance in relation to the parameters measured with the policies that have been introduced. And that is critically important. No other system is doing that. So the index is quite unique in that sense.
Right, thank you. We'll take the next question. Oh, sorry, you want to add anything, Woody?
I think from our perspective, the point of what we actually recognize the Johns Hopkins University effort as well. In fact, if it's not for their efforts, we won't even be able to do this. So credit is due to them. I think the point that Professor Rifat is absolutely on point, that what we are aiming to do is to track recovery. What a lot of the dashboards around the world is doing is tracking severity, tracking how many cases, how many deaths are occurring. But we actually really want to get out of the pandemic. So what we purposely designed are tools to track when countries are coming out of it as fast as they can, and what can we learn from them as quickly as we can as well, so that we can disseminate that information. And that also allows us to see, as lockdowns are being released, what's actually going to happen to those countries. And if things start to get worse again, what can be done to help them one more time? And there's going to be lessons to be learned there as well. I think there's no real playbook out there to do this, and that's why the Pathfinder initiative is immensely important. And I think this tool is used in tandem with that to get the results that we're looking for.
Right. We'll take...
Yeah, and may I just add to that?
Sure.
Actually, very important, just very short comment. And this is critically important. There are no off-the-shelf solutions. Or a playbook, as Woody was saying. It's very important to identify outliers in terms of good performers and understand what they did, and then try and adapt and modify these for different contexts. But continuously learn. I think this is what the GCI, the index, is able to do, is over time give us information on the trends and the responses and the effects. This is a marathon. We're at the beginning of the marathon. Until a vaccine is available, it's effective, safe, and scaled up.
Thank you. We'll take the next question. And this is from Professor Graham Kendall. Impressive tool, thank you. It must mean a lot of data collection. It is updated almost in real time. Is there a lot of work behind the scenes, or is it automated? And how long do you think this index will be maintained? This is a question for Woody.
Yes, certainly. Thank you, Professor Graham. I think the reality of the matter is when we embarked on this initiative, we wanted to recognize that we cannot do this without the combined efforts of these institutions around the world. That's why we give a lot of credit to the Johns Hopkins University for doing what they're doing, the Oxford University for doing what they're doing as well. There are a lot of researchers that are out there right now just putting this data together in the same spirit as His Excellency Kari mentioned just now, which is about sharing of data, sharing of open data. And we believe that as long as those dashboards continue to be operated in the way that is of value to all of us, we will be able to maintain this. In fact, when we were speaking to the World Health Organization recently, they were also interested to eventually give us that sort of data that they are getting and collating from the world, because they also want to be able to share that data across. So in that commitment from ourselves, we're looking at it as a period of 2 years to match that same duration that we estimate for a vaccine to be manufactured and disseminated to as many people as possible. That's a commitment that we're giving. I think as long as the data remains available, we remain committed to continuously enhance this and work together with all our partners to just get this as rich as possible and disseminate what we learn.
Right. Thanks. Sure.
There's a lot of work involved. In the last month, I mean, there's sleepless nights that, Woody and myself, I challenged him to no end to make sure that we get this absolutely robust, because I told him we can't go and tell the world that this is the index that ranked 184 countries. And if you come with an index that is disputable, and that's not acceptable. Right. And so we really work flat out to really go and do this. I can tell you, the next version that we will be telling you is a much more refined version. We got input from Professor Rifat, he gave us input about cohort analysis, and Professor Awang, he was the one who gave us the idea about, proportionate death. And everybody, all the analysis, correlation from Tan Sri Jamila, and everybody else gave us input. So it's a lot of work. To the question, it's a lot of work. Yes, a lot of work, and a lot more work that's required. But the good thing today is this. In the spirit of open science, there is a lot of information out there, but in a disparate form. Right. Pulling it together and making it coherent, that we can put a cool towel on the head and study the data and follow the best practice is the key.
Right. Thank you. We'll take the next question. This is from Heng Gui Lee. How does this GCI integrate with the current tracking mechanism used by the Ministry of Health? I believe Prof. Awang.
I believe that the current tracking mechanism used by the Ministry of Health uses cases and deaths and deaths. Now, the GCI basically draws the similar kinds of data. The only difference is that the GCI looks at as an index and as a composite index, and not only as a composite index, but takes this as a proportion or a percentage, which is compared against other indicators. So, for example, if you were to say, how would the number of deaths how would you compare the number of deaths, for example, between countries? Now, the easiest way people would do is look at the number of deaths per million people, which is one of the ways that people do. But if you were to compare this against the number of deaths that you had last year from all causes, for example, then a different kind of picture will emerge. And if you were to extend this, for example, to say that the number of deaths that you have this year because of COVID, and perhaps not only because of COVID, but because of other things which COVID has caused, which may be a possible indicator that you want to include the index later on, because it tells you what is the indirect effect of COVID, for example, on the healthcare system. So it becomes a much better way of comparing across states, across districts, and across countries, and becomes a fairer way of comparison. So I look at the current tracking mechanism used by the Ministry of Health is It's a quick way of looking at cases. It's a quick way of looking at the deaths and the severity by looking at the number of patients, for example, in ICU and the number of patients who require ventilation. But it doesn't really make it easy to compare between, say, Malaysia and Indonesia, or between Malaysia and Vietnam, or even between Malaysia and another country which is similar in terms of population size, but not similar in terms of the demographic makeup. So if you say, does it integrate? Of course it doesn't integrate, but it enables us to use the very same data which the Ministry of Health uses, but in a way which makes comparison with other places easier and a fairer comparison. So that's why I would say it doesn't integrate, but it complements, and perhaps because the Ministry of Health in Malaysia looks at Malaysian data only, it doesn't really compare with other countries. So when we say that the number of cases in Malaysia is 8,000 plus, for example, now. How does that compare with Indonesia, which is a much bigger country, which is 8 times the size, and knowing that the number of deaths in Indonesia is much higher than expected for the number of cases, for example. So how does that compare? So looking at the data which the GCI does is that it produces this and gives weightage and puts it up in a composite index. So putting it up in a composite index makes it easier for the layperson, and perhaps making it easier to look at the overall picture. Now, it's not that the dashboards which are developed by Johns Hopkins are difficult to look at. They are a gold mine for epidemiologists. But there's so many indicators, for example, at the Johns Hopkins dashboard, that you can't look at a single indicator and say that you're doing well, or you're doing better, or you're recovering. You can't do that. And looking at the GCI, it does tell you, if you give certain weightages, for example, to certain indicators, does it tell you the current health or the current efforts of the country? And the good thing about the GCI, because I've had the pleasure of looking at the indicators which have been developed in GCI, is that
committed to look into it in the future phases as well. I think that's part of the next phase, as Professor Rifat mentioned. We are into phase 2 now of the pandemic, and it's important for us to continuously adapt it. And so I take to the point that Dr. Sri Idris mentioned as well, we have a lot of work still left to do on this.
And I think it's I just want to add, to be fair, it's a completely different set of data. Economic data is completely different from what we're looking at in terms of severity and recovery from COVID itself. So that will take some time, but it's something that I've asked Idris and Woody to look into, because we want to map both of it together and see what measures coming out of lockdown have helped in terms of economic recovery.
Right. I just want to check if we have time for more questions. Yes, all right. Okay, we'll take the next question. This is from Karia Muhammad Hanafia. How can we avoid the GCI from perversely incentivizing for Woody? You get the good ones.
I think from our perspective, the whole point about ranking is really not to name and shame. The whole point about doing this is to be able to find a cohort of countries that are doing well, so that we can go and speak to them and find the practices from them. And we actually believe, because it's a relative scoring, at some point in time, countries will move up as well, and there's going to be learnings from them as well. So it's not really a case of naming and shaming, because in all honesty, some of these countries are also learning from the mistakes that they are making right now. I think even if we look very close to home, in all due credit, Singapore is doing an incredible job trying to come up from what they discovered as well. Although they don't rank very highly on the index currently, on their current trajectory, they're going to be way up there in the weeks and months to come. But it's the way that they're now contending with the fact that they have a foreign labor challenge as well, and other countries that we've also noticed are facing that same problem. So I think it's not a case about worrying about good data or bad data. I think for us, what we've tried to do is rely on these very reputable institutions to get the data sets. And as I mentioned, we're also planning to work with the World Health Organization to get the more acceptable data from all the different governments as well. And in moving forward, ultimately, we don't see it as a competition. I think if it's a competition, it's us competing against the pandemic as a whole, as the world. And it's not so much about competing with each other countries. That's really not the point of the index.
Right. Okay, we'll take the next question. Zaim Mozani, he asked, what can the GCI realistically achieve? Dato Sri?
First thing is realistically, in the next couple of months, we will be able to write a playbook and make it available on the best practices. We have already started to talk to those countries. Then we will find out from those countries that made lots of progress, what's working and what's not working in all the areas, so that these are then written down in a playbook that can be shared across. In that document, it will also, we will also identify what's not working.
Right.
And I think many countries are quite reluctant to see we made these mistakes. So I think what we will do there is to make sure that these are not exploited politically in those countries, that we will not make any reference to which country is having this problem. And so I think so that people are much more free in sharing this. So realistically, we believe that these kinds of lessons learned can be obtained. I can tell you already the document is already 100 pages, but we're not telling you now because it needs to go through fine-tooth comb to make sure every lesson learned and every element here is agreed by the countries that are actually doing it.
Right. Yeah, I mean, lessons learned. So unfortunately, we've run out of time to discuss this topic in more detail. Thank you once again to our panelists for all their insights, and His Excellency, Khairi Jamaluddin, for joining us today. Thank you to all of you who have joined us from around the world to witness the launch of the Global COVID-19 Index. With this resource at hand, we hope that countries around the world will now be more equipped to fight this virus. We're stronger and better together. So here's to good health and staying safe. A good day to all of you.